Hello everyone, this is Professor Leo Da Vinci. Nice to see you again. This time, we are going to talk about this breakthrough new edge cutting technology, 1726 nanometer laser for acne vulgaris. I always say this is a laser isotretinoin, but without the side effect of isotretinoin. It takes only 3 times of 30-minute treatments, then it can achieve the result of 6 whole months of medical treatment. Amazing, isn't it? Let's see what it really is.
Acne vulgaris is a common issue that leads to troublesome medical problems and post-event complications, including erythema, scars, and impact on self-esteem. In the past, treatments were either non-specific or had many complications. This presentation aims to explain the advantages and experience of using the 1726 laser in treating acne vulgaris and sebaceous gland-related conditions. The 1726 nanometer laser is a groundbreaking solution for treating inflammatory acne with several key advantages. FDA cleared for acne treatment. It is the only device cleared by the FDA for long-term inflammatory acne clearance. Precise targeting. The laser offers high energy and short pulse delivery, allowing the 1726 nanometer wavelength to selectively target the sebaceous glands, helping to reduce acne effectively. Published research. The laser has 6 published studies in a 24-month period, setting it apart from the competition, which lacks similar scientific backing. No anesthesia required. Unlike many other treatments, the 1726 nanometer laser doesn't require local anesthesia or numbing, with an acceptable pain level for patients. Advanced cooling technology. Its pressure-sensing sapphire cooling tip minimizes bulk heating of surrounding tissue, focusing heat on the sebaceous glands while ensuring patient comfort. Global use. Since January 2023, over 35,000 treatments have been performed worldwide, demonstrating the laser's effectiveness and growing adoption. In short, the 1726 nanometer laser is a proven, non-invasive treatment option for acne, offering both comfort and reliable results for patients globally. What it shows here is the absorption spectrum of the 1726 nanometer laser, which shows its unique targeting ability. From the graph, you can see preferential absorption by sebum. The 1726 nanometer wavelength is primarily absorbed by sebum, with a peak absorption at 1726 nanometer. This makes it highly effective in targeting the sebaceous glands responsible for acne. Sparing water. The laser has a lower absorption coefficient for water, which means it has minimal effect on the surrounding tissue. This is further enhanced by the device's effective contact cooling system, ensuring the superficial skin, epidermis to dermis, is well protected. With the effect of the combination of the above two features, it is so specific for sebaceous glands. Just like a targeted missile, the 1726 nanometer laser specifically targets the sebaceous glands, minimizing damage to other tissues. Results on skin. With its precise targeting, the laser leads to smoother skin, less oily skin, and fewer issues with milia and comedones. This also results in reduced eruption and acne over time. In summary, the 1726 nanometer wavelength offers a highly specific and safe solution for acne treatment, delivering targeted results while protecting the surrounding skin. There is a recent pivotal study concerning 104 subjects aged 16 and older, all suffering from mild to severe acne, were treated with the 1726 nanometer laser. The study was designed to test the laser as a monotherapy, with each patient receiving 3 treatments spaced about a month apart. We can see that the demographics indicate a comprehensive representation of acne patients, including those with varying severity and different skin types, making these results relevant to a wide range of clinical practices. For this bar charts, we'll be diving into the competitive efficacy of various treatments in reducing inflammatory lesion counts. We can see after 3 times of Aviclear 1726nm laser, there is a significant decrease in the inflammatory lesion counts up to 52 weeks. This is comparable to the treatment effect of 20 weeks of isotretinoin treatment. How about in terms of nodule count? For moderate and severe cases, there's a remarkable 71% reduction in nodules just 3 months after treatment. By 6 months, this increases to a 98% reduction, and at 12 months, we see an impressive 88%. Severe cases also show great promise, with a 69% reduction at 3 months, escalating to 96% at 6 months, and stabilizing at 79% after 12 months. These outcomes highlight the long-term effectiveness of laser treatment in managing even the most challenging acne cases. You can see the results of laser acne treatment across different Fitzpatrick skin types. Each individual received 3 treatments, and follow-up photos were taken 6 months later. Notice the improvement in acne severity from severe to almost clear. For moderate acne, you can see in 26 weeks the severity is downgraded into mild degree, and in 1 year the skin is almost cleared. Same case here, and you can appreciate the improvement, not only the acne vulgaris condition, but also the skin texture and smoothness. This is a great news for the patients. You can appreciate the whole journey of the patient is improving with time, and they will be happy for every follow-up visit to you. There may be some minor flare up in the middle, but it is very easily managed by simple medical adjuvant treatments that I will talk about later. This type of South Asian female patient recalcitrant to topical and oral treatments. Very commonly, they are reluctant to isotretinoin treatment, as quite a number of them are planning for a family while isotretinoin is teratogenic. With the laser treatment, no systemic adverse effect. In 3 times, you can see the clear up of this moderate acne vulgaris quite nicely. For patients with Burton type 4 acne, characterized by severe nodular, cystic, and inflammatory lesions across the face, the consequences go beyond the immediate discomfort. The active condition causes significant suffering, but the long-term complication of atrophic scars is equally concerning. Often, patients are hesitant to pursue oral medications like isotretinoin, which leads to delayed treatment and irreversible skin damage. Once atrophic scars form, they are challenging to correct and may leave permanent marks on the patient's skin with no return. In this slide, we observe the long-term results of laser acne treatment over a period of 4 years. Starting with moderate acne at baseline, the patient shows significant improvement, with results evolving from mild to almost clear at the 6-month mark. Even after the 6-month follow-up, improvements continued, reaching almost clear status by 2 years, and maintaining this outcome up to 4 years post-treatment. This highlights the long-lasting effects of laser treatment, with sustained results even years after the final session, offering patients lasting benefits and confidence. And one more thing is that apart from women that are reluctant to oral isotretinoin treatment, we should also be careful in treating the teenagers. As they are in their growth spurt, isotretinoin may close the epiphyseal end plate of the long bones that halts the growth of the teenagers. However, laser treatment will not have this kind of concern. We know about the good things about the 1726 laser, and we are all eager to experience the benefit of it. 3 treatments for 6 months of oral treatment with no systemic side effect. This is a revolutionary technology as never before. Our team accumulated some preliminary clinical experience in treating acne vulgaris by using this 1726 nm laser, and we are going to share with you all here. We adopted Cutometer model MPA 580 for the sebometer and hydration measures of the patient's skins. This is the accredited skin analyzer for the above purposes. And used AI-assisted imaging system for the evaluation of erythema and inflammation index counting of pores and quantification of sizes, small, medium, and large porphyrin, and adopted the graphical pain scale system to evaluate the pain level. We recruited 20 cases, giving 3 treatments of 1726 nm laser of 1 month apart. And after the completion of a series of 3 treatments, we follow up the patient further in 1, 3, and 6 months after. Now 9 patients has completed 5 visits, and in total we are aiming at 20 cases. First is the effectiveness of acne vulgaris treatment. This treatment targets mild to moderate acne vulgaris, with only 2 sessions required, each at 21J cm2 and 300 counts for full face. The results show obvious improvement with no erythema or inflammatory nodules. The inflammation index and sebum levels are notably reduced from 86 to 56. Importantly, there are no complications such as blisters, edema, or significant erythema. Pain levels remain minimal with a score of 2 to 3 out of 10. This treatment provides an effective low-risk solution for acne management. Building on the previous slide, after 3 treatments with 19 to 21J, say CM2, and 300 counts of full-face treatment, there is a noticeable improvement in inflammation and erythema. Redness levels show a reduction of 21% by the 4th visit. Minor complications include small 2 to 3 millimeter blisters around the mouth, but no significant blisters or edema. Pain levels remain low at 2-5-10. This demonstrates consistent improvement in both inflammation and redness, with manageable side effects and a positive outcome after repeated treatments. The trend is there, and we are sure that with more data from the study, we will generate more meaningful and significant results. As the laser ablates sebum gland, oiliness is also targeted by our study. So for the treatment of oiliness, only 2 sessions in this case, the patient reported clear improvement in melia and oiliness. In this particularly oily case, the sebum level decreased from 173.17 to 157.92. There were no significant complications, such as blisters or edema, and no erythema. The pain level was minimal, with a score of 2 to 310. This treatment effectively reduces oiliness and improves overall skin condition with minimal discomfort. Most of the patients actually comment that the oiliness decreases with smoother surface after the first treatment and before they see the further result of improved comedones, melia, and acne vulgaris. Let's look at this aspect more widely. In a series of 9 cases, the treatment demonstrated a clear improvement in oiliness with a significant 34% reduction in sebum levels with p-0.02. After 3 sessions of 19 to 21J CM2 and 300 counts of full face, the sebum levels decreased from 159.83 to 105.16. On average, the final reduction of oiliness reaches 34%. There were again no major complications, though small 2 to 3 millimeter blisters were observed around the mouth area in 1 case, but this recovers fully afterwards. Pain levels were minimal, with scores ranging from 2-5-10. This shows consistent and effective results for reducing oiliness with minimal discomfort. This treatment demonstrates a paradoxical improvement in skin hydration levels, with a 29% increase observed over the course of 5 sessions. Starting from 47 at baseline, the hydration level progressively improved to 60.6 by the 5th session. The trend shows significant improvement in skin hydration, with a steady rise at each visit, from 15% at the 2nd visit to 29% by the end. This result highlights the positive impact of the treatment on skin hydration, even with the expected treatment focus on oiliness or acne concerns. This paradoxical change may be due to a better hydration mechanism is restored with the excessive sebum production is corrected. Also, inflammation from acne vulgaris will also make the skin condition worsen and result in drier skin, although there is an overproduction of sebum inside the gland, but it is blocked and never be able to get to the surface of the skin. Further study shall be conducted on this particular interesting finding. Here comes to treatment for comedones and pores. This analyzer is excellent. With the AI processing, we can even count the number of pores in the patient and stratify the count into small, medium, and larger pores. This is what we cannot image to happen before. We can see that there is a significant decrease in the large pores from 551 into 145 counts, medium from 4600 to 2400. You may also notice the decrease of redness and inflammation of the face as well. Only 2 times of treatment. With the full treatment of 3 times, the result will be even better. After all of these positive treatment effects, we also look into any significant side effects and pain. However, we find it quite gentle. Although erythema and edema are the most common side effects, occurring in 100% and 98% of patients respectively, they resolve within 1 to 2 days with no prolonged downtime. Other mild side effects include acne flare-ups, 42%, dryness, 18%, and itchiness, 2%. Importantly, there were no unexpected or severe treatment-related side effects, and no cases of hyperpigmentation or hyperpigmentation were observed. This highlights the overall safety and minimal recovery time associated with the treatment. Acne's flare-up usually occur at the first treatment and as a mild one-time event. This is very easily managed by simple oral antibiotics. The mechanism of this is thought to be, in some cases, the potential acne-erupting sebum gland is ablated by the targeting 1726 laser. Therefore, it induces breakdown of the epithelial barrier and invite bacteria crossing the barrier and cause the infection. Therefore, this will invite detonation of Acne vulgaris. For tackling this, we have 3 important steps. Clear any sebum ridge close and open. Comedones first before the laser treatment. Observe closely the patient 3 days after the treatment. Usually, the detonation eruption occurs in 3 days. Give simple antibiotics to control. Actually, similar condition may also occur in the first 2 weeks of oral isotretinoin. The management strategy is actually similar. In conclusion, the Avaclear 17.26 N-meters laser is a high-power, highly specific, and easy-to-operate treatment for various sebum gland-related conditions, including acne vulgaris, melia, comedones, skin oiliness, and pore reduction. Clinically documented, it has proven to be effective for moderate to severe acne vulgaris. Remarkably, 3 treatments are as effective as 6 months of oral isotretinoin without the systemic side effects. Additionally, it offers minimal downtime and complications, making it an excellent choice for patients and practitioners alike. Again, as a comprehensive reading, a guide to aesthetic medicine and cosmetic surgery is the must-have resource for you. It is crafted by 41 leading experts from 13 plus countries and the latest innovations in the field. This book is now available online, including on Amazon. Scan the QR code to get your copy today. And yes, our Professor Leo da Vinci's YouTube channel is dedicated to bringing you high-quality educational content on a wide range of aesthetic treatments and innovations, and also other topics too. Here are just some of the exciting topics we cover: energy-based device treatments, injection therapies, everything from neurotoxins, hyaluronic acid, biostimulators, and collagen to achieve youthful, natural results. Thread treatments, learn about minimally invasive solutions for lifting and contouring, minimally invasive surgery, discover advanced techniques with less downtime, functional and integrative medicine, a holistic approach to beauty and wellness, anti-aging and longevity medicine, unlock the secrets to looking and feeling younger. More are updating to enrich the channel. The world needs your participation. Stay tuned. My dear friends, let's subscribe now and turn on the notification bell to never miss an update. Let's learn, grow, and transform the future of aesthetic medicine together. Thank you and see you next time.